I know we've done a little bit about this in a previous webinar, but do you feel that there's a communication or language difference between the language that doctors might use to describe symptoms and then the language that the community uses?
Oh, absolutely. I think the medical professionals deal in absolutes, lab results, data, medical journals, and that's kind of how they talk. But they hear about our symptoms, they do all the tests, but they don't necessarily experience them like we do, and it's hard to explain sometimes in 15 minutes, to a
Mm.
doctor. Um, but we as patients deal in unknowns on the daily, and we have a lot of symptoms, and not everybody is the same. And it's a lot. My current doctor just told me the other day, he's like, um, I don't know what you're feeling or going through, and I never will because I do not have SM. But I'm here for you. I want to listen to you and I want to learn from you. Um, but yeah, so it takes some finesse between patient and doctor, but yeah, there is a difference in the language for sure.
And from a practical point of view, and Shawna, maybe this is something you have seen again within the chats and the forums, are there particular pieces of language that could be helpful for someone again struggling to communicate with their doctor? Are there some particular differences that you've come across that you can say, well, if you use this language instead, it's more helpful, they understand what you mean? Is there anything like that that you've come across?
I think you need to stress how every single one of your symptoms. Never think that just because that one thing's not related to the other. I'm not saying everything is related to SM, but how did I know that the constant hospital visits, ER visits, which they kept telling me was food poisoning, was a mast cell reaction, right? Or how did I know that the constant clearing of my throat was a reaction to a smell? How do I, you don't know all these things are together. And again, because this is not something that is visually seen, they don't see the angst on your face. They tend to dismiss you because I would say, well, I'm in chronic for years. I complained about chronic bone pain and I described it. It's like sitting on a bar and I can't relax and I can't sleep and I can't take any kind of like painkillers, and they just dismissed me and sent me to physical therapy. Went, no, that's all related. Like the bone pain is part of that. These stomach issues is part of that. The histamine dump in the middle of the night that keeps you up from 1 a.m. to 3 a.m. like I had last night. It's part of that. So you lay it all out on the table. Tell them everything. They're going to have to put the pieces of the puzzle together. So just it can't hurt to be overshare.
I think that's a really important message, isn't it? Because especially in conditions where some of the symptoms don't seem to be connected, we can very easily not go to the doctor with the full description of what's going on because we've made the decision ourselves that it's maybe not relevant. So I think that's great advice. Take everything, lay it all out, and then let them decide what might be relevant or not, because that could be the missing piece of information that they need.
Yeah, I've learned more to go and share about pretty much anything new that's going on with me, whether it's related or not. And then I let the doctor tell me, oh no, that's something else or what have you. So yeah, it's a learning process.
Yeah,
Yeah,
absolutely.
I think that through our community, the most bizarre thing is like we'll talk about, whatever our symptom is for the day, and they'll be like, I didn't even realize that that was connected, right? So
Yes.
a lot of us will have similar things, and a lot of us will have different things. But on occasion, for example, I was having irregular heartbeats, and they put me on medication for irregular heartbeat a long time ago. And come to find out that was part of my personal mast cell issue. And then other people are having those kind of similar things. So you never know what is all related to this until you discuss it and you lay it out. So I'm not saying they're going to put the pieces of the puzzle together in a fast way because it took many years. But to be fair, I'm in the military system, so ours is a little bit different than like the public. I mean, up until 2012, every time we would move, my family, which is every on average every 3 years with the military, we would hand carry our records. We're about this thick for every family member.
Mhm.
So the continuity of care is not the same. Not that I'm saying it's bad by any means, but like who's going to sit down and read a book this thick
Yeah.
to go through and see how the pieces of the puzzle fit?
Mm. And what would you, maybe it's a question for both of you again, what would you want doctors or others to better understand about living with this condition?
A lot. This is something that last week, I think doctors don't understand that the littlest things can just drain our battery.
Mm.
Traveling,
Mhm.
just getting on a plane and going from one city to another and having to gauge the gates and gauge the timing and gauge getting on the Uber and going to the hotel. It's exhausting. And it sounds silly because that's just, normal things to do, but that type of thing is, I think, hard for a lot of people to understand, not just doctors. Um, that the littlest things that we do that would be normal for one person, for us, is very difficult.
Mm.
Yeah, I think what I want to say is that, for example, when a flare hits, it's not just it's an itchy nose or
Yeah.
whatever. It's a full body system attack on our organs, our bones, our nervous system. The most important thing is believe us when we're telling you that these symptoms are real. And my biggest thing is if you're not familiar with our disease, that's fine. You can admit that. We invite you to learn. We are happy to direct you to any resources that you need. And I've said this before, a lot of times when I'm referred to a different specialist that's not exactly in my like military network, or even sometimes in my military network, I will say, "Hi, my name is Shawna. I'm the first SM patient you're ever going to learn. Please learn from me." And then I go into the description, and I'm telling you, every time, sometimes in front of you, they will Google it. Or they will
Yes.
come back later and say, "You know what? I knew before calling you back that I needed to research this. So I felt more educated when we had a conversation." And I love that.
Yeah, that's great. And
So
actually,
we
that's
taught
quite
another person.
yeah, that's really good timing actually, because we've got a question here. I'm going to jump in and do a few questions. So we've got a question here. Can you help me with a short explanation of SM? I try to tell loved ones what I have, but I watch them shut down as I start using the terminology. So a really practical
Mhm.
tip there for someone.
Yeah, people's eyes glaze over when you go into long
I want to.
descriptions.
I think the simplest version is going to be your body is in a constant state of fight or flight, right? So you don't know, because you don't know what is going to trigger you. Is it going to be a smell? Is it the bucket theory where you didn't sleep well, you're not hydrated, you haven't eaten today, you're overstressed? All these things adding up just automatically trigger you. So, for example, if somebody gets bit by for me, like if you get bit by a mosquito, you have a little, you have the welt, right? People are like, "Oh, that's so annoying." Okay, that's us times 1,000,
Mm,
right? So everything that happens to us is a trigger like that. So for me, when I get a mosquito bite, I'm going to have a welt this big, sometimes this big for a week or two because my body is just overreacting to everything. So I would just say that our body's in a constant fight or flight, and we're always trying to protect ourselves.
mm,
Yeah. And
yeah.
we have an overabundance of mast cells, and it's due to a mutation in our somehow we got a mutation at some point in our life, and it just made our all of our mast cells from head to toe overpopulate. They're overstimulated, and they're basically just, yeah, what Shauna said, fight or flight or in attack mode,
And they're in every
24/7.
organ of your body. They're in your
Yeah.
skin, your nose, your stomach, your GI tract. That's why the stomach issues, right? And then
Mm,
like the smell triggers. It's
Yes.
everywhere. It's not it. I don't know. It's hard. People, they tend to not
It's
believe you
hard.
because they don't see the angst. They don't see the pain. They're like, well, if you're in pain, why aren't you like, why isn't your face all angry? I'm like, because like, who's going to walk around all day with pain, right? And who wants to hang out with
No,
Debbie Downer? Nobody.
fake it till you make it.
Yeah. I mean, that's another thing I think is kind of our age group, Kelly. And we're just like,
Yeah, I got to put
just,
on a happy face.
yep.
And then you go home and crash.
Yeah, that's true because you build it up all day and then your body's just like, all right, you need to give in. And
I'm
then you just like
done.
crash. Yeah, peace out. Night, 8 o'clock, you're in bed.
Yeah.
Yep.
And I think there's that the anxiety, because from what I understand as well is that even once you know what your triggers are, you can develop new triggers. And you, of course,
Yes.
there's also the constant living with fear that something new, of course, is going to cause a flare up. Is that right?
Yes.
Yeah, for sure. I didn't think about recently we had a bunch of forest fires in southern Georgia and I was having horrible burning eye pain. And I was, when I'm at work, I wear a mask all the time because of all the constant simulation and when I'm outside my office. And so when I go outside the door, I'm like, oh, finally I can take my mask and breathe fresh air. And then I walk outside and then it's like hazy and smoggy because of the smoke. And the burning eye symptoms were just so overwhelming that I actually had to get a special prescription eye drop to kind of coat my mast cells in my eyes so
Wow.
that I could drive home and not have to pull over because I'm so reactive to all this. So who would have thought that? I mean, I know of course smoke in the air is going to bother you, but just some random thing that would happen here in Georgia that would trigger me.
So we have another question here. This person has been diagnosed with SM Vera GI biopsy, BMB negative and normal tryptase through testing. GI symptoms are the most common, but I've experienced tachycardia, flushing, and migraines. I'm being told that my symptoms should be limited to GI since abnormal cells were found. But how do I advocate for myself and disagree? So I guess this question is around if you're not completely happy with the what's coming from your medical professional, how might you advocate for yourself to either get another opinion or have that doctor kind of listen to what you have to say?
Yeah, I'd say get a second opinion. I've gone through three doctors here in Fort Worth and finally found a new doctor in Houston. So I'm traveling, but get a second opinion. There are so many, nothing against physicians, but this is such a rare disease that not all physicians know about it enough to test properly. And the Mast Cell Disease Society has on their page the testing criteria to properly diagnose. And, unfortunately, if doctors aren't following that, there's a lot of misdiagnosis out there,
That's
unfortunately.
correct. I feel don't feel guilty about firing
Mm-mm.
your doctor. If you're not getting what you need from that doctor, go to somebody else. Like if you go
That's
to
right.
a hairstylist and you don't like that, you're going to go somewhere else. So why do you have that fear with the doctor? You're important and your health is important. And a lot of people don't know this, but when you have biopsies and testing done, by law in America, they have to keep those samples for X amount of years. I think it's like 6 or 7 years. So you don't have to necessarily have to retest that. You can go to another doctor and they can have those slides retested and you can have another evaluation.
We have another question here. I like this one. It says, so do you struggle to tell others about this disease, especially co-workers? Other than family, I struggle with how to tell others or if I should tell anyone. When you bring up the word cancer, people shut down. Sometimes it's
Mm-hmm.
easier to not tell anyone and suffer in silence.
I don't work anymore since being diagnosed, but Shawna might be able to answer that better, being she still has coworkers.
I'm gonna try to explain as best I can as not to alienate them because you're correct. When you start wording using the word cancer, they I don't know, it's people just shut down and they get fearful, right? But you're like, okay, well, it's like the slow kind, right? And you can explain to the best of your knowledge, but I think personally, unless they know somebody who is dealing with this on a daily basis or somebody in their family, it's just really hard for your coworkers to wrap their brains around this. So, give them a little bit of information so that you can be able to work and function in that environment. And if you need disability accommodations regarding that, then absolutely speak up for yourself. But you're going to find from their reactions whether or not they are going to interact and or believe in you. Again, I have a group of friends that 100% believe me, and I used to work with some of them, and they are totally accommodating in everything we do. Once a month we go out to dinner, and we they know, and they care about me. So you're not necessarily, to be honest, a work is work, and you're there to work, and sometimes it just happens.
Yeah. Question here from a participant. So their 9-year-old daughter was diagnosed with mastocytosis a few years back. Meds mostly help with symptoms, as has been said, but at times she does seemingly go into uncontrollable panics where she doesn't
Mhm.
respond. And this person would like to know, is there any advice on how to help her through that? So from your perspective, when you've been in a crisis because of the SM, is there anything that your loved ones or friends or people around you can do to help you through that process?
I can't hear you, Kelly.
She's just so young. I think just love and support. I think, there's a lot to be said about breathing exercises. I don't know for a 9-year-old, but
Yeah.
breathing exercises, um, and just kind of talking her down out of that anxious moment.
I think maybe you need to recognize that I understand you're having these issues, or I mean, kind of talk to the child, but also goes back to, are you making sure that that they have the best supportive care in place? Do they have the medications on board? Are they hydrated? Are they fed? Are they tired? Or like, what is triggering? What is building up to this? Maybe that child's bucket is full, you know and on top of the fact that this is rare, then you add the children into it, that's even worse. It's like super rare. On the positive side, generally children with this outgrow it by the time they're adults. From all the studies have showed. I mean, we have a mutual friend that has had it since he was like 2, but just listen to them, acknowledge them, and then make sure you have the best specialists on your team if you can, for children.
Thank you. That leads really nicely into the next question, actually. Nina has asked, any hints on how to get various specialists in different hospitals to communicate with each other? My hematologist and immunologist communicate, but my cardiologist, who ironically first diagnosed a mast cell cause, has no direct communication at all with the systemic mastocytosis consultants. He's discharged me and expected the SM consultants to find a suitable cardiologist and dysautonomia consultant, but that's not happened. Is that something that either of you have experienced, having to encourage different specialisms to become part of this, multidisciplinary team around you?
Yeah, I've experienced that. Before I found a center for excellence in Houston, I experienced that. I had I had numerous specialists I was seeing, and I found there was quite the disconnect. None of it, like you're saying, none of them are talking to each other. What I would take it on myself, advocate for myself, print my labs, print tests, whatever I had to have to take to that next referral doctor so they would see what's going on and why I'm in his office. So I had to be kind of the connection between all of the doctors. And I'll be honest with you, being a patient with SM is a full-time job. You are your number one care team. You've got to take care of yourself and advocate for yourself. And so there's a lot of work involved in that. And so unfortunately, just us as patients have to do a lot of the footwork on that, unless you have a care
Yeah.
team that's in one center.
Yeah, that's I think that's a miscommunication. I don't know if in America we have so many systems that they don't necessarily always talk to each other, and you can never assume that the outside doctors talk to your inner bubble. So you're going to have to hand carry or ask for those copies of those records and ask them to be uploaded in so that everybody is on the same page. You just have to advocate for every step of the way. So if I go somewhere, I'm going to get that report later and I'm going to manually add it via the portal or have somebody else add that to my health record.
Yeah, don't ever assume that they have it, because I've
No,
made that mistake and they don't have it and I thought they did. So, yeah, I just hand carry things.
Really good question here as well, from Naida. So they were diagnosed in autumn 2025 and they're still figuring out their triggers. They're asking any advice for tracking symptoms and not getting overwhelmed or fearful in the process. So they were tracking, but they found it quite overwhelming sometimes. Is that a process that you have to gently ease yourself into, or just make it part of your routine? Is there a way to kind of avoid the overwhelm of the onslaught of symptoms and tracking that for appointments?
I think that being so newly diagnosed, um, that person might be going through the stages. So we go through our stages of denial, acceptance, the grieve, your past selves, and then once you come all through all that, then you can get to the point where you can do the symptom tracking. Because yes, you can go into full panic um, of all these things coming at you. I mean, you can do something simple as when you're having a bad day, pick your phone up and say, make note, blah, blah, blah. And then, track those notes later. I use an app called Bearable, and you can customize it to yourself and how you want to track your diagnosis. You can track it every day, 3 times a day, whenever you want, and then it'll pull statistics. I put the brain fog, the bone pain, the whatever is particularly bothering me, that burning eye symptom that I had a couple weeks ago. I just add that in there. Then you can kind of follow the wave of symptoms and try to maybe figure out what is triggering you, what is not, and then you can present that information to your caregiver.
I think it's important for people to understand as well that process of going through the stages isn't always linear. We hear that a lot here in the rare disease space, that, you might have your acceptance, your grief of your past self, and you think you're getting somewhere, and then you kind of go back to denial again, and the grief comes in waves. So it's not this straight line of acceptance of having a rare condition. It can be very up and down and back and forth, and it's a journey.
Oh, absolutely. And it really is comparable to losing somebody. And you've lost yourself. For me,
Yeah.
I lost my career. Like I said, I went through depression, and yes, it goes in waves. You think you're, going, "Ooh, I'm feeling pretty good," and then all of a sudden you're tanking again, and you go back to that, missing that person that you were, missing being active, missing being social, missing, partaking in life like you used to without a care,
Mhm.
without having to plan things and think about what you're doing and how long you're going to be there. So, yes, it's definitely goes in waves. Just when you think you got it, I've been diagnosed for 3 years, and it's still a process.
Yeah, for sure. Definitely. You used to be able to just go, oh, I'm gonna go to the pool today, or I'm gonna do this
Hmm.
today, and then everything is great. But now you're like, okay, let me just figure out, I make a plan for like 10 things and I actually do two. And I'm like, oh boy. Back then I would have been very disappointed, but now I'm like, well, at least I got to do two today. So right. So you just kind of have to reframe your thinking, and we're just planners now. Everything we do, we have a plan in place. Do we have our epinephrine pen with us? Are we hydrated? Have we taken our medicine? Have we, you know what I mean? It's just part of our everyday checklist, like kind of like, do I have my phone before I walk out the door? Like you just, it's part of your
Yes.
checklist. It's your new
Yeah.
normal.
I used to be able to schedule, you know, back-to-back doctor's appointments all in one day. I used to like to get it out of the way.
Yeah.
Now it's no more than two and maybe going to get groceries. Groceries will
Yeah,
throw me over in between. So yeah, we have to plan a lot more than we used to.
for sure.
And I know that for both of you, you both live with the two different types of mastocytosis. Somebody's asking here, does anybody know how well accepted it is by medical professionals that there is some sort of link or overlap between other conditions such as POTS, hypermobility conditions, with dislocations and pain and systemic mastocytosis? Is that something that either of you have experienced?
I have not, but I have heard all of those things. Yes, there are overlappings.
Yeah, there are some I believe there are some studies that a lot of some of the POTS patients are more
Mhm.
in our SM
And
community and
hats
has,
too.
it's just they haven't had a lot of research regarding that as much as they would like to confirm that yet. But they are working on that and they will eventually figure that out. But I mean, you've got to think that SM has been around for 60, 80 years. And not until the last 10, 20 years has there been a lot of direct research
Mhm.
for that and our help. I mean, when I was diagnosed, there was no medication directly that could target the mutation. So things have come a long way in the last 4 years, honestly.
Thank you. And there's just a comment here that says, Shawna, thank you for mentioning firing your doctor. I got a new allergist a couple of years ago who told me that I really have MCAS and put it on the record. They were diagnosed with cutaneous mastocytosis in 1985 by a punch biopsy. She fired him and insisted that they
Wow.
remove the MCAS diagnosis from their record. It's gone, and so is he.
Oh, that's
For
awesome.
you.
You know, just to touch on that, and a lot of people don't touch on that, that I want to say that the percentage is about 90% of people with adult onset cutaneous mastocytosis will in fact have systemic involvement, also systemic mastocytosis.
Mhm.
There's a huge number, and there's a lot of studies, there's a lot of information that says that. And I wish I would have known that in 2012 because I would have pushed a little harder to get the information I needed to get my diagnosis earlier. But, I believe there's a plan in life and things happen for a reason. And you can't look back, you have to look forward.
Yeah. Absolutely. Thank you. I think that's a really good place to end on today. We've had wonderful questions from your community. I know we've said it before, but the systemic mastocytosis community is one of the most incredible communities that we've come across. You're so active and involved and really, come out and show up for these events that we put on. So we're very, very grateful. Thank you both, Shawna and Kelly, for your insights. And again to Blueprint Medicines, a Sanofi company, for sponsoring the second in the series of 4 webinars. Webinars 3 and 4 will be later on in the autumn this year. This webinar will be available on demand in the coming weeks on our website and on the YouTube channel, so please do keep an eye out for that and share those with your networks for people who couldn't attend. They will be broken down into smaller bite-sized chunks. Please feel free to reach out to us on the screen at the end, which has got some contact information. I've also put some information in the chat box about our Systemic Mastocytosis edition, which has been translated into several languages as well. But for now, many thanks, and I hope everyone has a great rest of your day.